Dr. Ghatan, I would like you to talk about liposuction and the improvement liposuction has brought over the last years, maybe decade or so. Lots of people, they had liposuction years ago, but apparently there have been major improvement made in technology on how much better it works, how much more convenient it is to the patient. Can you shed some light on that?
Sure. Basically, we as dermatologists do the liposuction in an office setting under local anesthesia for the most part. We can do a large part of the body at one session, but we try to limit our session to prevent any problems. And that's where some other colleagues of ours have had difficulty when they've been doing this under general anesthesia. They've been using the dry method versus the wet method. The wet method is what we do, and that entails using anesthetic with sterile water, saline, and this way we'll decrease the chances of bleeding, decrease the chances of hitting the wrong areas and causing problems. Patient is much more comfortable afterwards, and we do smaller areas, but it's the safer way of approaching it. There are new technologies available now with ultrasound where the fat is emulsified, it's broken down so that it's easier to suction it out, and you go ahead with the liposuction to take it out. It's quite a comfortable operation. It's done under local, again, in the office. Afterwards, there is minimum discomfort. There may be some bruising, some black and blue, some changes in sensation, which are all temporary. But people do very nicely with it, and the effect is, some of it is immediate, and over time we see more improvement because the damaged fat that is being cleared from the body over time. So it's a very gratifying procedure, and then people have shown a lot of enthusiasm about it now.
Right. Well, liposuction, as I hear, is not made so much for weight loss rather than for making us look better, get rid of those love handles, of those extra things to contour us. Now let me ask you this: once a person has done a liposuction, will that fat grow back very fast? Because it's unlikely that most of us change our lifestyle habits. That's why we got them. If we could change them easy, probably we would never really need a liposuction. We would just eat less donuts, exercise more, whatever it takes. But chances are that we don't do it. So what can we expect there in them things growing back? I have heard that those cells don't reproduce anymore. Shed some light on that area, please.
Yes, I'm very glad that you brought this point up. First of all, we do make sure the patient understand that this is not a weight loss program. It's meant to remove extra fat on different parts of the body where people are prone to get these deposits of extra fat. We do tell people that there is a good chance of the fat coming back in those areas if the person goes on to gain a substantial amount of weight. We know that there are parts of the body that are more prone to that. For example, abdomen is more prone to gain the fat back than it is, say, under the neck area. Okay. But yes, if people are not careful afterwards, they definitely are prone to gain back what was removed by liposuction.
Okay.
But I just want to make a point. What we found in our practice is that oftentimes people get more motivated after liposuction. They see how good they look. They feel much better about themselves. They go on a routine exercise and a diet program, that it helps them to maintain what they gain through the liposuction. So it's a good incentive, a good start on the right path.
It's a little bit like wearing new clothes, a new suit, and automatically we walk a little straighter, huh?
Right, yeah.
Okay, well that makes sense. So the fat can come back, but it doesn't come back like immediately. It will take an excessive amount of, again, eating and weight gain. If a person just slowly accumulated it over many, many years, it won't come back within weeks or months, right?
More likely not. It takes some time.
Okay, good. Well, wonderful. If it comes back, could a person repeat it and do it again? Or is that a procedure in a certain area you can only do once?
It definitely can be done more than once. And we've had, in fact, people who come to us for repeat treatments. They had treatment somewhere else and they felt it was not removed enough, or maybe they gained some back. So we do it. It's not a problem.
Okay. All right. Wonderful. Thanks for your candidness and telling it the way it is. It has a chance of coming back, and here it is, and that's just all there is to it. But thanks God, it could be possibly removed again. And I like the part that you mentioned it, because it's true. When for some reason we look a little better, whatever that is, what makes us looking better, we do have a tendency to keep it up a little bit more and be more eager to keep it up. Dr. Ghatan, bye bye.